that's bright. Almost can't see Tim behind it. Good to go? Great, thank you. Well, good morning. I'm standing up today to address some of the pressures we are seeing across our public hospital system today and our EDs. I've invited Dr. David Rosengren to participate today. He is the Acting Chief Operating Officer of Queensland Health and also a highly experienced emergency physician who can talk more about what we're seeing in our EDs right now, but also some of the work we are doing within the public health system to address these demand pressures. Before I do hand over to Dr. Rosengren, I do want to just point out some facts as at today. We have 520 long-stay patients who do not require medical care in our hospitals today, who need an NDIS or aged care package. We have another 462 patients in our public hospital beds with COVID and an additional 49 patients in private hospital beds with COVID. I have 1,643 health staff who are currently isolating because of COVID on top of normal absences in the health system. And we are probably going to be experiencing our worst flu season that we have seen in almost a decade, and it's coming at us quickly. Despite this, we created around 351 extra beds last year across the public and private sector with a $263 million investment. And we were starting to see improvements through those extra beds and also other initiatives that we were putting in place, where in fact some regions were starting to record a 30% reduction in lost time with our ambulances. However, the demand pressures are continuing. Now, we have delivered consecutive record health budgets. We've added an additional 1,300 new beds since coming to government. We've put on 13,000 extra frontline staff. We had a record health budget last year and will continue to have record health investment both in our operational budgets and our capital budgets going forward. In the last financial year, we saw more than 1.7 million patients, and we continue to see it within the clinically recommended time, and we continue to see an increase in the number of patients we are seeing within clinically recommended time year on year, despite these demands. However, we cannot do this alone. The fact is that we need investment in Commonwealth health funding, in aged care, in NDIS, in private health insurance, and we need more support for GPs, including Medicare reform, so that we can attract medical students into the general practitioner system and to attract them to work right across our decentralised state. Now, this is not about shifting responsibility, it's about sharing responsibility. And it's not about politics, because it's not about what myself and every health minister across the country of all political persuasions are calling for, but it's also what health professionals across the board are calling for. I have numerous articles here of GPs and health professionals over the last few months who have all said that due to the shortage of GPs across our regions, this is putting pressure on our health system. We've seen health professionals calling for the Commonwealth to step up and give their fair share of funding to help. But I'll just give one example. Omar Khurshid, who is the president of the AMA nationally, who has recently said, as recent as the 14th of May in an interview, that the reality around ambulance ramping is getting worse in every state and territory over the last few years because our hospitals are full. He goes on to say the only solution to ambulance ramping is to deal with the logjam in the hospitals, and there's no quick fix for that. A message that I think the Leader of the Opposition could certainly listen to. That requires long-term investment in capacity Some reforms, it requires a lot of money being spent, and the only level of government that has the capacity to do that is our Commonwealth government. The AMA goes on to talk about what those reforms should look like, including fair funding around the national partnership, the artificial cap of the 6.5%, and we know that they've been calling on an increase in the Medicare payments to GPs so that it is affordable for GPs to go into practice and stay into practice and to attract and retain them in the regions. But we know it's just as hard to get in to see an affordable GP, or any GP for that matter, in metropolitan Brisbane as well as in our regions as well. So we need to come together. We need the Commonwealth Government realising that the pressures on our public health system are just as much caused through the primary and allied healthcare failings, and that they could be working with us across the country to help with these pressures that we are seeing in our hospital system today. Despite any lack of action from the Commonwealth, we will continue to do what we can and to invest and provide record investment in our health system here in Queensland in our public hospitals. But the demand pressures are very much driven by other factors that we cannot control, and those demand pressures have caused the public health system in Queensland to become the provider of last resort. When you can't afford private health insurance, when you can't get into private specialists, when you cannot access GPs, when you cannot get an NDIS package, when you cannot get the support you need in aged care, you turn to the public health system. We will never turn a Queenslander away from care. But sadly what we are seeing is Queenslanders having to wait longer than they should because we cannot get the Commonwealth to recognise that they have to share in this responsibility, and we need to do this together. I'll now hand over to Dr. Rosengren to just talk about some of those things we are seeing right now and what more we're doing. Thank you.
So thanks, Minister. First and foremost, I really want to reassure Queenslanders that they can continue to have absolute confidence in being able to access world-class hospitals and emergency departments 24 hours a day in Queensland. And I can say that with confidence because as a senior emergency physician, I work alongside my medical colleagues, nursing colleagues, our Queensland Ambulance Service paramedics to ensure that despite the challenges that we face, we continue to provide world-class health care to our members of the community that require it. There is no question that at the moment we are seeing unprecedented demand for emergency care across our hospital system. This is not unique to us here in Queensland. We are seeing these challenges around emergency demands for care in every jurisdiction in the country. Everybody knows that we've faced significant challenges around our response to COVID over the last couple of years, and in particular since the start of this year with the Omicron surge that's challenged us with regards to our emergency department and our hospital capacity across all sectors of the state. But the really reassuring thing is we've responded to that challenge remarkably well. We've continued to ensure that there is reliable and regular access to care both in an emergency and for people that require their planned care as well. And it's that ability for us as a hospital system on a daily basis to balance the needs for emergency care with the needs for planned care that actually position us to ensure that we can front up to the community and assure them that we are optimising our resources and our capacity to continue to ensure that there is access to care for those that require it. We are facing some impending further challenges which will create some difficulties, and we can't back away from that. In the last couple of weeks we have seen a concerning surge in the number of influenza cases reported across the state. And we've in particular seen a surge in the hospitalisation requirements, including intensive care admissions with people with influenza. And so we have to appreciate that that is added to the burden of our coronavirus demands, and that really does challenge our ability to continue to ensure that we can maintain access. We are worried this year, and it is a very important message for the community to understand, we haven't had a flu season in Queensland now for a couple of years. The dominant strain of influenza this season is influenza A. 98% of all of our influenza cases is influenza A. Influenza A is a serious illness. It has serious impacts on our young and on our older and more frail people, particularly those with chronic disease. But also importantly, influenza A has a significant illness impact on our young, healthy people. And so we are seeing increasing numbers of people who are becoming unwell, high fevers, headaches, muscle aches and pains, nausea, vomiting, diarrhoea, respiratory symptoms. And so it is absolutely critical that we have a strong community commitment to supporting ourselves, our families, our friends, our loved ones, our work colleagues, and ensuring that vaccination against influenza is a priority for all Queenslanders. If we see a continuing trend over the next couple of weeks consistent with our current numbers, we're seeing a doubling of the number of diagnosed influenza cases every week. And so we are anticipating that over the coming weeks we will see increasing impacts. That impact will be in the community, but that impact also affects our workforce, our doctors, our nurses, our allied health professionals, our ambulance officers. And so again, we're working very closely in all of our hospitals to ensure that we have our workforce vaccinated, that we have strategies in place to ensure that we can maintain our rosters across a 24-hour cycle, to ensure that we can live up to that commitment to Queenslanders, that they can have that absolute reassurance that they can access the care when they require it. It is absolutely essential that every Queenslander knows that if you need access to an emergency department for emergency care, you can access that care within our emergency departments. In order to ensure that, though, we do ask the community to make sure that you partner with us in that. So as I've already referenced, vaccination is critical. That actually helps to ensure that either you avoid contracting influenza, or if you're unfortunate to get influenza, the seriousness of the illness is significantly reduced. Making sure that people with chronic disease are maintaining contact with their general practitioner on a regular basis to ensure that they remain well throughout the winter season. And we will have a whole range of strategies from the health system that we will implement to make sure that we can surge our capacity to respond to the needs as they arise. We've done it, we've proven we can do it throughout the coronavirus response, and it's a simple process for us to ensure that we embed and continue those strategies moving forward. That will include continuing to commit to telehealth and virtual models of care, continuing to support access to care in our residential aged care facilities. So we provide in-reach nurses and doctors that visit our residential care facilities and support the staff that work in that environment to look after and maintain the well-being of those residents. We have strategies around partnering with our Queensland Ambulance Service, with medical senior emergency physicians that work with ambulance around triage and prioritisation of demand. And we have a very well-established model working with Queensland Ambulance Service to ensure that we manage the emergency demand, particularly our ambulance demand, across our emergency departments to ensure that patients get access to the right care in the right location and at the best available time frame. So we've got a proven track record. There's no question our emergency department staff are working very hard. We can see that on a daily basis. I know that, I live that with them. And so I would ask the community to be respectful of our staff in our emergency departments, to acknowledge the challenges that they are facing and their absolute commitment and dedication to continuing to ensure access to care, and that if you're a Queenslander and you need to access our emergency departments because you're unwell, then please feel free, because that's what we're there for. Thank you.
You talk about, Dr. William, you talk about you want Queenslanders to have confidence and be reassured. At the same time, you also talk about the challenges that we are going to face. We all know the situation that we're seeing now. There's no question that ambulance workers and emergency workers are doing an incredible job. But how can Queenslanders have confidence, given these challenges you say are coming up, when we've already seen Queenslanders die waiting for ambulances?
So at the moment, the best answer to that is we've proven that over the last 2 years. We've mounted the most extraordinary response to the health system, in the health system, to our coronavirus challenge. We've continued to ensure 24 hours a day people can access our emergency departments for care. We've continued to deliver essential planned care, elective surgery. So patients with cancer requiring their urgent surgery and all of those other things, we've continued to ensure that we have delivered that. We will continue to ensure that we will deliver that. There is no questions that with emergency care that we see surges. People don't plan to have an accident or have an illness. People don't plan or schedule their abdominal pain or their respiratory illness. And so the natural ebbs and flows are that on occasions we do see surges in demand from both walk-ins and ambulance requirements in our emergency departments. And we flex up and we respond to those challenges, and there are times where we do have to make sure that we use expert clinical advice to prioritise the order in which care is provided, and we do that really well. So Queenslanders need to be reassured, and it is a justifiable reassurance that they can access that care, and it is world class, and we mustn't forget that.
And authorities were warning this was going to be a very bad flu season. We were told that Queenslanders would have confidence in the system in the lead up to flu season. It's barely started. What confidence can people have in the system, and what preventative measures were put in place to ensure that these pressures would be dealt with?
So from a response point of view, we have that response in play, and we haven't actually ramped down our COVID response. So all of those infrastructures around responding to COVID surge continue to remain in place for our influenza, and it's essentially the same principles. So the message to the community is actually really consistent with our coronavirus message. Please, if you haven't been vaccinated, please get vaccinated. Do not think influenza is a disease only of the frail elderly. As I've mentioned, influenza A causes significant illness in our young, fit, healthy population, and that's a well-proven clinical syndrome, and so we do encourage and urge all Queenslanders to get vaccinated. Everybody knows the importance of hand hygiene, cough etiquette, social distancing, stay at home if you're clinically unwell. Make sure, if you've got chronic disease, that you maintain contact with your primary care clinician, your GP or your specialists, around ensuring that you maintain yourself in good health during our winter season, so that you don't become unwell with your chronic disease and then get complicated by risk of exposure to influenza. The message is simple: vaccination, hand hygiene, social distancing, stay away from work if you're unwell. Community have proven absolutely fundamentally that they know how to do that, and it's been absolutely effective in reducing the spread of coronavirus throughout the last couple of years. So please stick with it. You've learned to do it really well, and it's been a great contribution to health sustainability.
What measures have Queensland Health put in place that's people taking the initiative to get vaccinated?
So Queensland, so we have a program to ensure that all people that work within Queensland Health have access to free vaccination. We support, through our primary care and other sectors, vaccination for our vulnerable members of the community. So if you're older than 6 months and less than 5 years, you get access to free vaccination. If you're over 65 years of age, you can access free vaccination through your community care sector. If you're pregnant, you can get free vaccination. If you've got chronic disease and multiple comorbidities, you can get free vaccination. There is widespread access to vaccination against influenza through your GP, through your local pharmacy, and we would strongly encourage all members of the community to participate in that. You've done it for COVID and you've seen the benefits. The same message is true for influenza.
Minister, doctors are saying that they've been warning about this for years and that the demand on hospitals has nothing to do with COVID. What do you say to that?
Well, what the physicians have actually been saying, and even in your own paper today, wasn't that it's got nothing to do with COVID, that what COVID has done is further exacerbated the pressures on the system. I have been standing up for more than 12 months now as the Health Minister, saying that we have got year-on-year demand. I have not simply been talking about COVID. I've been talking about the fact that people cannot get in to see a GP, that we have a failing in aged care. Now, you've just heard from the Chief Operating Officer that we have nurses going out from the public hospital system into private aged care facilities to provide care. Why? Because private aged care facilities do not have registered nurses on staff full-time. Imagine if they did. We had 41,000 transfers from an aged care facility by ambulance to our EDs over the last calendar year. 41,000 transfers. So I've been talking about aged care, I've been talking about GPs, I've been talking about disabilities, and talking about the need for our fair share of Commonwealth funding. And I'm not the only person to do it. There are numerous health professionals, key stakeholders, including the AMA, who have been saying this for months. It's been reported in your paper, it's been reported by the media generally, both here in Queensland and across the country, that these health stakeholders have been saying that we have a shortage of doctors in the community, and this is leading to extra pressure on the public health system, and this has been building for years. The Medicare payments to GPs have been frozen for more than a decade. There is only 15% of medical students who are going out to practice as GPs. We need that to be 50%. Even here in metropolitan Brisbane, talk to anyone about how easy it is to go into and see a GP. A parent who's got an unwell child, if they can't get in and see a GP that day, they're going to turn to the emergency department. But we are also seeing a significant increase in chronic illnesses in our hospitals, where we are seeing people needing hospitalisation for longer and for more complex conditions because they're not able to get regular checkups by GPs and look after their healthcare in the community. So these are things I've been saying for more than 12 months. Sadly, the Commonwealth are not listening. They are not listening on these things. There's a productivity commission in relation to aged care that says what needs to happen. They've been hearing the failings in the NDIS system. When we asked the relevant ministers to implement the initiatives that happened during COVID in 2020 to fast-track people out of hospital beds, we were told no. We said we wanted that embedded as normal practice, and the answer was no. No justification why they wouldn't do that. But the Commonwealth has equal responsibility here, because we can keep building beds, and we will. We'll keep building hospitals. We've got more hospitals being built. We'll keep putting on health workers, doctors and nurses and allied health care professionals. We will keep putting in place new initiatives like the mental health co-responder model that we've got happening with paramedics, that is seeing more than 60% of people with a mental health episode being diverted away from an emergency department. We'll keep investing in all of these things. However, we can't control the demand pressures coming from the primary and allied healthcare sector, where there is market failure across the state, and they're turning to Queensland hospitals as a last resort.
We don't have a commitment from federal Labor or the coalition about a 50-50 health funding split, so how do we, I guess, go forward with that?
Well, I've got much more confidence working with a federal Labor government because they actually understand the benefit of health. I've got an outright no from the Commonwealth on the Morrison government. No. Every health minister in Australia has been told no when it comes to 50-50 funding, no when it comes to the 6.5% cap. And so, you know, that is very concerning that we're hearing that. The public also need to know that under the Morrison budget this year, the National Partnership COVID funding ends in September this year. September. We've all asked across the country that that money be extended at the very least till the end of June next year, 2023. It ends in September. I'm pretty sure there is not one piece of clinical advice, including from AHPPC, any advice globally that says COVID's going to be gone by September this year. So what's going to happen when that funding disappears as well? So we've got every right to raise these issues, but I will say, as far as commitments, it is Labor and Anthony Albanese who has made a commitment for 24/7 nurse staffing in aged care facilities. I know that will make a difference.
United Workers Union is saying last Sunday was a particularly bad weekend for ambulance ramping, particularly in that Metro South Ipswich area. They're saying that ambos are exhausted, they're at their wits' end. What's your response to that?
And, you know, I saw the reports that, texts went out calling for extra staff. That's what they do. That's the great system that we've got, that the Queensland Ambulance Service is able to flex up really quickly when they see that demand was happening. And they saw that demand was happening for about 48 hours over Sunday, Monday particularly, and so they call in extra staff. But there is only so many staff you can call in to deal with major surges like that. Again, I think it was Logan Hospital, which was, only less than 10 patients off their highest number they've ever actually seen present to an ED in a single day. So we continue to see, sadly, those records being broken about the number of people, both ambulance call-outs but also just presentations to ED. And as the doctor said, we'll deal with those surges as they come. They're not every day, but those major surges, we do what we can to react quickly to deal with that. But I know our paramedics, our operational staff and our call centres, our doctors, our nurses, our allied healthcare workers across the health system in Queensland are exhausted. They are absolutely exhausted, and we are doing everything possible to support them, but there is a shortage of health workers across the country, and that is another pressure on our system right now.
You've raised a lot of valid issues, especially around GPs. But when we talk to the doctors in the health system, the AMA included, they say that the biggest cause of ramping and emergency department pressure is the fact that bigger hospitals and more hospitals weren't built 10, 20 years ago. There's just not enough beds.
Well, we continue to invest in beds. We've got a pipeline of over 900 beds to be in place by 2026. We continue to invest in extra beds in the private sector.
So, yeah, those beds have been built 10, 20 years ago.
Oh, look, I can only talk about the fact that since we have come into government, we have increased bed capacity another 1,300, that we've got 3 hospitals being planned currently. We have significant expansion happening at big hospitals like Logan and Caboolture right now. We've got Marta Springfield. So our pipeline of investment is there for everyone to see, that we continue to build, to expand, but the rate of growth that is happening right now in Queensland is so significant. But, you know, we will have record investment in our health budget again this year to deal with those demands.
We're reaching a point where, for Queenslanders to get prompt and good medical service or good medical treatment, that people need to start reconsidering about going back to private health insurance because the public system isn't coping.
Well, they can't. They can't afford it. Cost of living's going up. And what we are seeing is private health insurance is going up far greater than wages. Wages have stagnated. People are dropping out of private health insurance, and what I see and what I hear when I travel around the state and visit our hospitals is that even people with private health insurance are coming to our hospitals. They're coming in as outpatients, they're coming into our EDs. And even though we can charge back to the private health, it's still a bed. It's still beds because there isn't a sufficient bed capacity and the specialists needed in the regions to be able to provide those services. So people are still coming to us.
The opposition is saying that ambulance bypass is now back and that potentially more lives will be lost as a result of failures by the government.
I'd love David Crisafulli to actually sit down with all of these stakeholders. I have no doubt that he meets with the Royal Australian College of GPs and the AMA and all of these stakeholders who are saying to him that is a combination of a whole lot of things. But when you have the president of the AMA in this country saying what this needs is a major injection from the Commonwealth, that's what will deal with bed block, then they should be listening to that. But as far as this claim around diverting ambulances away, Dr Rosengren has already explained we haven't had that practice operating for a decade in this state. What we have is now a coordinated central hub that looks at all of the EDs and actually is working side by side with the Queensland Ambulance Service about what demand's coming in, where we have capacity, how many ambulances we have at every hospital ED right now, and where to send them. So it's not any hospital getting to make the call, we're not accepting you, and bypassing them. That hasn't operated for a decade. It is a coordinated centre that we make sure we're sending them to the right hospital in the first place, so they don't have to be diverted.
Should GPs be refusing to see people if they have respiratory, symptoms and tested negative to COVID? And can you talk to how?
No, I don't believe they should. I mean, we can't do this alone. We need our GPs in our community to be working with us. And I know, I'm not going to criticise our GPs. I know they're working tirelessly. I know that many of them have closed their books to new patients because they just can't fit them in. Because we have so many GPs retiring and there's not enough GPs coming in to replace them. And I have GPs in towns like Townsville who retire, and there's another 300 aged care residents that are not being cared for. And so what do? The staff pick up the phone to the Queensland Ambulance Service and ask for an ambulance to take that person to hospital because they don't have the qualified staff and they no longer are being serviced by GPs in their area.
A few weeks ago you were talking about getting more ambulance and paramedics on for the winter season.
Yep.
So what is Queensland Health doing to alleviate pressures just in the state system for the winter and flu season?
So we, as Dr Rosengren have already said, we continue the strategies we put in place late last year, early this year around the COVID surge. So those strategies are just as relevant for the flu as they are COVID, and that includes partnering with the private hospital sector. So we still have those partnerships. As recent as yesterday afternoon, I got briefed by Health. There isn't an end date to that partnership. It's ongoing for us to actually call up private health beds to be able to move staff into the private sector to create opportunities to put patients into our public hospital beds as well. So it's very much a partnership, and I want to thank the private hospitals for that partnership. I know they've got a lot of loss of staff as well. I know with lifting of quarantine requirements, we've seen a real improvement across the economy for businesses to get staff back. But when it comes to health, I've still got 1,600 staff today that are furloughed for COVID alone. And that is inevitably putting pressure on our system as well.
Dr. Rosen, Miss, actually, just quickly, the health ramping statistics, when are they going to?
So our performance data will be released this month, which is the same time last year. May and June is roughly when performance data gets released, and it will go out this month. This month.
Can I ask what work, I guess, or ground have you made on ensuring health workers are working in their full scope?
So we continue to work with all of the stakeholders, including the Queensland Nurses and Midwives Union around that. I want to see our nurses operating to full scope. That is part of the Unleashing Potential report, as well as many other recommendations from other reports and inquiries. We know, and that's what part of the nurse practitioner model is about. Our nurse practitioner, a lot of people will come into an ED and just be seen by nurse practitioners, and they are highly qualified and capable of seeing those low acuity cases and see people be able to go back home quickly. We also have the nurse navigators, which are making a huge difference in making sure that people don't fall through the cracks in the system. So all of those initiatives, of course, we're working with pharmacists as well around our election commitment around trialling in North Queensland a full scope practice. So that work is continuing as well, and also the UTI trial that is ongoing.
Sorry, one last thing. In the past 2 years, you've had to prove you had a flu vaccine to enter an aged care setting. Do you imagine that would come into place this year?
So I will take the advice of the Chief Health Officer in relation to that, but there is no doubt. I asked the question yesterday of my staff, where we at with our flu vaccinations for our public aged care facilities, both staff and patients, but also our general staff. We need to make sure that's happening as quickly as possible. I am very concerned what I'm hearing about influenza A and the risk to very healthy young people getting influenza A and potentially needing to be hospitalised. I strongly encourage people to get their flu shot. And even though we know that we're almost at 94% of Queenslanders 16 and over have had their first dose of COVID vaccine, which is incredible. Thank you, Queenslanders. We still have almost 40% of the Queensland population have not had their booster shot. And that concerns me because we know the booster shot reduces the risk of being hospitalised and ending up in ICU from the Omicron variant. We've got way too many people who have not had that booster, and we still have way too many children who have not been vaccinated for COVID. I am going to write to the Commonwealth based on the briefing I got around the flu yesterday to see if they will consider looking at broadening the availability of the free flu shot, because I don't want cost being a factor on whether someone gets the flu shot this year. Considering the pressure that's going to put on health systems across the country on top of COVID, I do think we need to be looking at whether the flu shot can be offered at a cheaper rate or be provided free, particularly for this flu season this year, and I'll be writing to the Commonwealth in the next couple of days about that.
Dr. Rosen, the last time we saw ramping like this level was back in about 2011, 2012. How does the situation now compare to back then?
So access pressures in emergency departments are not new. It's a conversation we've been having for many years. Over the last decade, the volume of demand and the volume of care delivered in our emergency departments by our expert doctors, nurses, allied health professionals has grown at a staggering rate. And they have responded to and continue to respond to growth in demand year on year on year. We will always be challenged by surges in demand on occasional episodes, and we did see that over the weekend in some parts of the system. And we have mechanisms in place to lift and respond, to increase our resources, to distribute our demand, to ensure that patients get the best care in the right place in the best available time. It's not a new strategy. We continue to respond to growth demands. The Minister's already identified increased investment in new beds coming online to give us greater hospital capacity.
Does it compare now to then? Is it as bad as it's ever been, or is it worse, or is it better, is it the same?
There are surges where we see increased demand in our emergency departments that cause all emergency departments to struggle on episodic occasions, and then there are many times where our demand is well managed, and that hasn't changed over the last decade. Our mechanisms of care, our workforce strategies. In my emergency department that I work in, we have advanced care, allied health professionals, physiotherapists, we have clinical pharmacists who work side by side in our resus and trauma teams. We have advanced care social workers supporting domestic violence and sexual assault victims. We have a whole range. We've modified and adjusted, introduced scope of practice increases, nurse practitioners. We have adapted and will continue to adapt and evolve with maximising scope of practice, modifying models of care, working with ambulance to support the community in particular to only need to be in an emergency department if they truly require emergency department care.
A lot of doctors have said who work in emergency departments and paramedics, they are very concerned. They also talk about they fear, it was in the paper this morning, and we've heard the same things, they fear missing something because of just how busy it is. Your language, you seem quite comfortable, it's all sort of under control. Is it two different messages happening here, or are you comfortable, or are you worried that doctors could miss things?
Look, emergency departments are designed to be able to cope with surges in demand. And I can describe it is very fatiguing to be a clinician working in an emergency department. I will go home at the end of an evening shift pretty much exhausted and spent from the commitment to ensuring that we continue to manage the demand that comes through. There is no question that our clinicians in our emergency departments are tired. Everybody in the healthcare system is tired. The demand and the pressures for healthcare are significant in primary care, in acute hospital care, in planned care, in the private sector, in the public sector. The response to our current health demand is not anyone's problem. It's everyone's problem. And that means everyone in the community, as well as our healthcare workers, as well as the healthcare system. And so when I say it's everyone's problem, then we need to encourage the community to go out and get your flu vaccination. Go out and get your COVID vaccination. Don't contribute to the burden of demand in our emergency departments by finding yourself in the back of an ambulance being transported to the hospital because you haven't found the time or the effort to go and get your flu vaccination. I saw a young 19-year-old gent in the emergency department last Thursday night with influenza A who described never having felt so bad in his entire life. If you don't want to feel so bad in your entire life, then my challenge is go out and get your flu vaccine. Go out and get your COVID booster because it works. We know it works. We've proven it works, and it is going to be the single largest impact on minimising unnecessary demand on our emergency departments.
In terms of bypass, I think you wrote the original Meadow report talking about how dangerous or how bad bypass was. You're comfortable that's not happening in the system now?
Yeah, the concept of bypass where an emergency department shuts their doors to patients is absolutely not a model that exists and has not for over a decade. We have a very strong relationship with ambulance. We work side by side with them. They are part of the Department of Health. We have a central coordination hub, and each health service has their own coordination hub, which brings ambulance and experienced clinicians, nurse practitioners and senior emergency doctors who work together to manage the demand. We have a call centre, 1300 Health, that works in order to support community with regards to the appropriate access to care. And we have very well-proven triage methodologies. In the ideal world, no delay would be perfect. But not everybody requires care instantaneously, and we do work carefully with ambulance and emergency department clinicians to ensure that when patients do try and access the system, that we make the right decisions around the clinical urgency and the priority of their care. And so sometimes that means people do call the ambulance for a less urgent condition, and because of demand, they do need to wait a period of time. That's not ideal, but it's a decision that is made and continuously reviewed. Our doctors in our ambulance hub are forever continuously monitoring the queues, monitoring the demand, making sure that the decisions are right to ensure that the patients get access to the emergency department or the appropriate care setting that's right for their needs in the right appropriate time.
How do we incentivise more people to move to the regions and be a nurse and a doctor in the regions?
So that's a real challenge, and it's something we've been struggling with for quite a number of years, for decades in fact. And our workforce situation, it's not just in health, it's in all industries, is in fact that we don't have enough doctors, nurses, allied health professions, administrative staff, ward clerks, ambulance officers, even in Brisbane. So we do have significant challenges around workforce, and it's not just our regional areas, it's actually in our metropolitan areas as well. So that's why models around optimising scope of practice. It's around making sure that our nurses are working to their maximum scope, that our allied health professionals, our physiotherapists, our speech pathologists, our social workers are all working to their maximum scope. And we have to explore new models of care and new ways to deliver care, because when crunch comes to crunch, our community expects that and they deserve that. And so we will continue to respond, but the harsh reality is healthcare, like every other industry, is currently struggling with the workforce demand and the available workforce out there to fill that demand. And we'll continue to promote education from the ground up, so university placements. We do an enormous amount of education in our public system for the future health professionals of all sorts. We work with the professional colleges and the professional bodies around doctor, nursing and other allied health training, and particularly with rural general practice, around advanced care programs, around upskilling our GPs in rural and community settings, around providing support with accommodation and other living circumstances to increase the attractiveness. And that's often done in partnership with the local communities. So I know that in many Queensland communities, the health services work with the local mayors and the local commerce organisations to try and ensure that they can attract and retain quality healthcare professionals so that the community can access care close to home.
Do you think there should have been more hospitals and more done 10, 20 years ago to fix that would have helped with the ramping and the demand issues now?
Well, when you look at our demand at the moment, it's easy to say yes to that. But again, I've just been describing the challenges around our workforce. So there would be nothing worse than having a whole pile of hospital beds and no one to staff them. So at the moment, we are continuing through the Department of Health and with the health services to bring on significant increased bed capacity. We have, in response to COVID, there's been over 360 beds that we've brought on emergently to deal with the surge, which we continue to keep online as we talk, and there's another 900 plus beds that will come on over the next 5 years. But it's not so easy as just building a bed. We need doctors, nurses, allied health professional awardsmen, X-ray technicians, etc. So we have real requirements to continue to grow and invest and retain our workforce, an ageing workforce. And so that's a continuous challenge. So it's not so simple as just building another bed.
And the United Workers Union said the other night that the EA ambulances were leaving to go and get treatment elsewhere for their patients. Is that they were just making their own decisions on that, do you know? Or what, we talk about no hospital bypasses, we're going to clarify that.
So there is no process of hospital bypass. No hospital in Queensland, no emergency department makes a unilateral decision to close their doors to any Queenslander. And as I said at the very start, Queenslanders must have absolute confidence if they require emergency department care, they will get it. We have a very organised, very established and continuously evolving process to distribute the load across the system. There is no use having 25 ambulances at one hospital when 10 kilometres down the road there's another one that only has 2. And so it's well established, it's an organised process partnered between ambulance and our health professionals to distribute the load to make sure that patients get the most timely care. And so that is what happens on a daily basis and will continue to happen even when we're having surge periods.
Elective surgeries, are they just still postponed at Logan, or is that happening elsewhere?
So I made reference earlier on that we, on a daily basis, balance the demands between emergency and planned care. So everyone that's waiting for their elective surgery is important to our health system in Queensland. We don't make unilateral decisions just to stop doing planned care. We are doing planned care at all times. We are continuing to ensure that patients with urgent cancer get their cancer surgery when they need it to ensure that we don't have increased disease burden. We can't keep up with the demand to ensure that everyone who needs elective care gets it done at the time frame that they want to, But we continue across all of our hospitals to deliver planned care, and we adjust that on a daily basis according to the demands that we're facing. And so that's one of our strategies for optimising our emergency capacity, is we can up and down the balance between our booked activity, our theatre activity and our emergency department activity to continue to ensure that people get access to care in the most timely way.
So is anywhere else aside from Logan post-COVID then? Queensland Health Service?
So across the system, as I said, every single day hospitals are making judgment decisions based on capacity around their surgical demand. We're prioritising continuing to do surgery everywhere we can. But on a daily basis in individual hospitals, there may be decisions that will get made based on capacity and the balance between emergency and acute for some surgery to be rescheduled to meet that demand. That is a standard practice in all hospitals, in public hospitals and private hospitals. It's not unique to any individual hospital, and it's not a blanket process across the state.
So do you know if it's currently happening anywhere else other than Logan?
As I said, it's a standard practice we use to manage our demand across the system to ensure that we're balancing access to care. If we make a blanket process that says no planned care gets done, then we end up having empty beds and empty capacity and operating theatres not being utilised. It's our obligation to ensure that all of our hospitals are optimising their volume of care they can deliver, and so we do that on an adjusted basis to guarantee Queenslanders that they get the care that they need in the most efficient time frame.
Thanks all.
Thanks everyone.